malaria transmission dynamics, high-risk groups, and related definitions. So, starting with the global burden, this is the data from World Malaria Report 2020. So, which is the estimated the malaria morbidity is around 229 million cases, and 29 countries contribute to the 95% of the global burden. Most of them are from Africa, and 409,000 deaths were reported, recorded deaths in 2019, and again, most of the deaths are from Africa only. So that's what it is mentioned. The WHO African region accounts for 94% of all malaria deaths in 2019. You could see the high, more cases are reported in the reddish areas. So the cases based on the population and the numbers. So it shows that. And the cases depending on, you can see the variations, the color changes based, and then it has been described below also. So coming to the spatial distribution of Vivax and Falciparum. So the one which is on top is of Falciparum distribution, reported in the South American, which includes Latin American countries. And cases are also reported in some parts of our country, and then Cambodia, Thailand, Cambodia, Vietnam, and Myanmar, and all, and also in Southeast Asian region. And the map which shows below is the distribution of Plasmodium vivax, and mostly in two major countries. One is in India and Papua New Guinea, the country which is above Australia. Then the Latin American countries, which includes Peru, Mexico, Central American, Peru, Mexico, then Latin American, Peru, Colombia, Brazil. So these are the case distribution as far as Vivax and Falciparum are concerned. So, and the global trends in distribution of the cases, you could see the malaria morbidity is by and large in African countries, except for India, which is showing 2%, and others. So if you consider this, 93% of the cases are from the African subcontinent. A majority of the cases are from Nigeria, and then you have followed by DRC, Congo, and then Uganda and all. So the description shows that percentage of cases in each of these countries. The deaths reported, so you could see the deaths reported in the country. Again, it is more in Nigeria, as more number of cases are reported there, more number of cases, more deaths also in DRC. Here again, if you see the other countries, especially outside African subcontinent, so or you can find India and others which comes under the other countries, so outside Africa. So the 93% of the cases are from the African subcontinent. So, and then this part shows the different cases. Again, in other 1% or whatever. We have around 1% of cases in Indonesia. Also a lot of deaths reported. So, if I've explained to you about this transmission dynamics in the VVC, but still I would like to have this slide because this shows the interactions between the host vector and host vector, then pathogen and environment, and which plays a role in the transmission because these are all interlinked. And you find the risk groups are young children, pregnant women. Travelers also brings in cases, and then you need to have the conducive environmental conditions, which plays a role in the host parasite and vector. That is temperature, as far as extrinsic incubation period is concerned, relative humidity for the survival of the mosquitoes, humid nature, and then so that mosquitoes could survive for a longer period, and precipitation, the rainfall, which helps in more number of breeding in a particular area. Wind directions also helps for the mosquitoes to move from one area to another area. So the environment plays, and then you have the pathogen. Four different malarial parasites are Vivax, Falciparum, malaria, and ovale. But then there are simian malarial parasite species which transmits zoonotic malaria parasites to human beings. That is a cycle which happens, which continues from animal, mosquito, and then human beings. But then human to human transmission has not been reported. So therefore, these parasites, that is Plasmodium knowlesi, Plasmodium cynomolgi, and Plasmodium innui in Southeast Asian countries, has not been included for malaria elimination. Similarly, there are other parasite species in South America, that is Plasmodium simium is also reported, and these are zoonotic malarial parasites. So, but then knowlesi, of late, knowlesi has been reported in some parts of Odisha and also in Kerala, which is a cause of concern. So, and if knowlesi is present, and then if the cases are coming up, and if human to human transmission happens, that could be a dangerous situation. And the vectors, you all know about the 6 major primary vectors. So, which has been, you have the Anopheles stephensii, the urban malaria vector, then the rural vector, Anopheles crucifixus, the foothill malaria vector, Anopheles fluviatilis, and then the fringe area vector, Anopheles minimus. Then the dirus group, which is known as Anopheles maimai, which is there in deep forest areas, and the coastal malaria case vector that is seen in Andaman and Nicobar Islands, Anopheles sundicus. So this is the major transmission cycle, the transmission dynamics, which shows the interaction between the host environment, the parasite, and resulting, helping the vectors and or interlinked for the transmission of the disease. So I just want to show a pictorial description of the vectors in malaria vectors globally. So there are many vectors which you need not bother, but then we are concerned about the 6 major primary vectors, and also in addition to it, there are some secondary vectors which also plays a minor role in some places in northeast area, especially, and also in the coastal areas, like subvectors plays a minor role. There are other vectors also, depending on the parasite load in the community, this could play a major role in the transmission of infection. But otherwise, you can see so many other vectors are there in, especially in mainly in African country, it is Gambiaceae and stricto, that is sibling species of 8 species, and they have been named also like Arabiensis, Phenastis, and also, this has been named also. But then in our case, in Anopheles cultivar, it is given name acronym of A, B, C, D, E. So, but we have not named them separately. So that is something which the taxonomists will have to do it, and will have to think about naming these vectors as different sibling species as as vectors, so that they could be given separate acronym. So I just want to show, start with some breeding habitats in an urban area. So these are habitats, tanks, over tanks, which plays a major role in the transmission of, which plays a major role in the breeding of Anopheles stephensii. All these tanks, over tanks, and housing board flats and individual private buildings can play a major role in providing appropriate habitats, conducive habitats for the vectors to thrive. And you can also see some of these habitats which are not approachable, and they are kept open, and that could help the breeding of Anopheles stephensii, oviposition of Anopheles stephensii. And since the vector is breeding there, and then you are not approachable, the treatment or the intervention cannot be carried out so by the program health workers. So you also find some of these habitats may be covered, but then you will find some holes on the sides which could again help the vectors to enter and then oviposit in these habitats. There are other sources which are in dilapidated conditions. They are unused, but still water stagnation would be there because of the rains. Nowadays, you know that severe rains were there for the last 2-3 months in most of the place, and you find water stagnation here. And if these wells, if these overtanks are not used, this could lead to a heavy breeding of Anopheles stephensii. So you may have other habitats also, like for example, whether it's a cistern or whether it's underground tank. And nowadays you find many of these barrels which acts as the water storage tanks on the ground level, and it is connected to a motor, and then water is connected directly to the house. And in these habitats also you find cohabitation of Anopheles stephensi and Aedes aegypti, which is again a cause of concern as far as the urban area is concerned. There are other habitats, other potential habitats. This is a well, you can see open well or draw well, so and underground tank. And if the water level is very low, and then or halfway down, you could find breeding. And then if it's not covered, then you will again find breeding. And then also in some sort of cisterns, which are kept outside the house in the peri-domestic area, this will also have help in the breeding of malaria vectors. In a rural area, you find it's feeding channels or slow-moving streams or big ponds or rice fields or ditches. Wherever it is, you find the breeding of another vector called Anopheles tulicifaces. In fertile areas, you find breeding of Anopheles fluviatilis. But then in large areas like a paddy field and all, where transplantation is happening, you would find breeding of Anopheles tulicifaces in addition to other JE vectors. So like Culex tritidium, Ringus, Vishnu group. So these are some of the breeding habitats as far as malaria vectors are concerned. And coming to the burden, I thought of giving you a brief description about the burden of malaria. The malaria incidence has been mentioned in 2020 because India, the report published shows that by Hay et al. Indicated that malaria incidence is 9 to 50 times greater than whatever is reported. And then by Dingra et al., the former director of National Vector-Borne Disease Control Program, he published information stating that the mortality is 13-fold underestimation. So, which again indicates that the cases recorded in the public health domain would be much lower than what is in actual scenario. And the disability adjusted life years is 1.85 million daily, so which is again a cause of concern. But then Southeast Asian countries during that particular year, the last one decade shows around 60 to 70%, and most of them are from India, contributing to quite a bit of deaths. So we need to have a robust and comprehensive epidemiological surveillance at regional and sub-regional level to find out the actual scenario, depending on the cases reported in private health clinic and also other clinics which are not contributing or which are not sending the data to the government machinery. And we find that gaps are poor coverage and surveillance in many places, many cities. The reporting and the coverage and surveillance are drastically different or widely gapped. Whereas some places coverage is good, some places it's not good because of lack of manpower and so many reasons. And recording and reporting is also not accurate. There is an inaccurate recording methodology, and then the reports are not properly done. The treatment seeking behavior also changes from a health facility, that is from a government health facility and a private facility. And sometimes you find self-medication and also distribution of drugs across the drugstore. So that is another thing. The pharmaceutical shops in front of the pharmacists themselves will distribute drugs without a proper diagnostic method. So these are all contributing, and these are all gaps as far as malaria is concerned, malaria burden is concerned. And you find lack of cooperation with private sector in reporting. And it happens in secondary or tertiary hospitals, even in big hospital, tertiary level hospitals. Some of these, though it is mandatory to report malaria cases, it is not being done. So these are, naked facts which, one has to see. And then if the elimination drive, we all know that elimination drive is there. And then by 2030, we need to eliminate the malaria in our country. So for these things, these gaps had to be rectified. On an average, the utilization of government health facility is very low. And there is, if you take an Indian perspective, that is because in rural area, only the utilization government health facility like primary health centers are much better. But then when you see the urban areas, the private sector dependence on the private sector, the health and the treatment seeking behavior towards private sector are more because of so many reasons. It could be because of better healthcare facilities or better facilities in private hospitals or better care, then or it could be insurance mechanisms where they could, and also attention to a particular patient. So it could be more because since you're paying the to the hospital, so they take a better care. So that those are many facts. There are many facts related to which plays a role in the gaps attributed towards the burden of malaria. So coming to the eco-epidemiological paradigms, so we have a lot of paradigms which are, quite known. We have the forest, forested or tribal malaria case and restricted in many places like Odisha, northeast areas, and central part of MP, Chhattisgarh, Jharkhand. These are states where malaria cases are more as far as forest or tribal malaria is concerned. There are forest or tribal areas in most of the states in our country, but still cases reported by those areas are comparatively lesser than these areas. So therefore, this importance has been given to these areas where cases are more from these areas, northeast, especially central part of MP, Chhattisgarh, Jharkhand, And as far as urban malaria is concerned, these are some of the cities contributing to more of urban malaria, unlike the rural malaria cases, like, for example, Chennai or Goa, Mangaluru, Mumbai. A lot of cases were reported in these places, Visakhapatnam, Kolkata. Some of these, there are 131 towns and cities, so wherein a lot of cases have been reported. UMS was started in 1970s, 71. But since then, though UMS is in action, but still we find a lot of cases in this area. Industrial malarial cases, malarial associated with industrial belts like Haridwar, a lot of cases were reported. Now it has been brought down to drastically, and Rourkela also cases have been brought down. So, and then you have plain malaria. So, plain areas, Gujarat, parts of Rajasthan, which the vectors are also different. In Gujarat, sometimes you find anopheles basis. Parts of Rajasthan, because of the canals, you find Anopheles stephensi and Anopheles basis breeding in some areas. Foothill areas you find in Uttarakhand, and also you find cases of malaria and some cases of plasmodium malaria has also been reported. So these are different epidemiological paradigms as far as malaria is concerned. So when you see the malaria burden framework, so you have a lot of factors which plays a major role, as I said. So the external factors involve the environmental, the ecological, the climate, the socio-economic aspect, population movement, the vocation, housing condition, roof structure, population displacement. So many factors are related to it and also plays a major role in the transmission, the demographic, age, immunity, gender. And coming to the healthcare system, it is the accessibility to a particular healthcare facility, affordability. Can you, in private healthcare center, you don't have to pay, so you can go. But in government health sector, you don't have to. It's you don't have to pay, but unlike in private healthcare facility, you have to pay. Then only you get the treatment. The quality of the healthcare system is also varies from the urban and rural areas. The efficiency, the demand and utilization. So all those are involved inbuilt in a healthcare system. And as far as the treatment seeking behavior is concerned, and program also plays. They have a policy, drug policy, or larviciding policy, or vector control policy. So these policies also helps in refining the intervention measures and support and partnership is also one aspect. So you have different agencies like NBBCP at the center in Delhi, and then you have local state health, national vector-borne disease control program playing a role. Regional level offices are also there, and in corporations it is done by health departments separately. So all these agencies who are in the jurisdiction takes care of the health matter, and then the intervention includes Health Alliance, IRS. The environmental management includes the source reduction methods as well as, and then bioenvironmental control methods. So that habitat manipulation, our resource management is there. So the treatment includes the early diagnosis and treatment facilities. So, but then in all these things happens in primary health centers, but in some private hospitals also, they have a fully fledged private diagnostic centers. Some places they have outsourcing the methods. So the knowledge level, at immunity level, or at the community level, includes the cause, the prevention methods, early treatment. So they have some sort of cultural beliefs. All these matters as far as the malaria morbidity, whether it's infection, whether it's malaria cases, or the mortality is concerned. So these plays a major role in the burden, and this acts as the malaria burden framework. And then there are several factors involved with it. So private-public partnership is there. So many things are there. So, but then by and large, this is the major thing which affects the infection. Takes care of the burden and framework. Okay, so I mean, coming to the malaria infection, so transmission aspect. So the vector, as you know, the vector is needed. So, and you have stable and unstable malaria depending on the transmission, whether it's throughout the year or not, or whether it's marked by some sort of fluctuation, whether it's seasonal or any specific attributes which plays a major role for some part of the year in high transmission areas. So they are considered stable, and throughout the year it is considered as unstable malaria. And there are several factors affecting the distribution abundance of Anopheles mosquitoes, that is the vector mosquitoes, whether it's primary or secondary, which plays a role in the transmission potential. Microclimatic conditions in a particular area, then so that it plays a major role in the resting and resting of vectors, extent of water for vector breeding, and it also plays a role in vector breeding, and then abundance. See, there could be seasonal fluctuation. Most of the areas you have seasonal fluctuation playing a role. Seasonal fluctuation plays a role in areas where, depending on the temperature, the seasons, different seasons. In summer season, you find less number of adult mosquitoes. Therefore, the infection is level. But then after rains, monsoon and post-monsoon, you find a lot of cases. And during the end of the year, when winter season comes, also you find cases coming. So vectorial capacity of the common vector species, it is linked with some the bionomics of the vectors. So the many factors are involved in it. So vectorial capacity also plays a major role in the transmission, and conditions suitable for the vector survival. Though vectors are there, so many other factors are also, but vectors should have appropriate microclimatic conditions, conducive conditions for the vectors to survive. If it doesn't survive, the transmission doesn't happen. So earlier, the types of endemicity, earlier literature, if you see the endemicity, it's holoendemic, but the same thing, holoendemic, hyperendemic, mesoendemic, and hyperendemic, mesoendemic, and hypoendemic. This endemicity was based on the parasitemia as well as the spleen rate. So, you can, and most of this literature, early literature, you will find the endemicity varying based on this spleen rate and the parasitemia. The present scenario shows that, so the endemicity right now is based on the parasite rate, in addition to the spleen rate, because the endemicity is based on the parasite rate. That is, parasite rate, if it is less than 10%, is known as hypoendemic. If it is greater than 10 and less than 50, it is meso, and then more than that, 50 and less than 75, it is low. So you find now, you don't find any holoendemic areas nowadays, or hyperendemic is also very less in hotspot areas. Mostly it is meso or hypoendemic because of the elimination drive, and also LLIN and ACT has played a major role right from 2000 to bring down the cases in many places. So that is how the cases are very less, and therefore the endemicity is now based on the parasite rate. And you also find population, many people are at risk. It is based on the definition as such. It could be the ethnic groups in a particular area, the migrants who are moving, construction-based workers, or migrants who are moving from one place to another, from an endemic, non-endemic areas, the urban poor who are exposed to who are having, or live in thatched structures or poor living conditions. They are exposed to vector bites, and then they are very high risk group. Then also you have the pregnant women and children, where the immunity level would be less, and so that they are susceptible to infection. And then inaccessible population who are restricted in a particular area, they are also. So these are the population at risk. And the conventional method of estimating convention method of estimating the infection is based on the annual parasite incidence in terms of 1,000 per population. If it is greater than 10, it is higher risk area, and 1 to 10 is moderate. So less than 1 is low risk area. So nowadays, earlier it was the API more than 2 was considered an area for making spray and IRS and all. But then because of the elimination drive, 1 and above also is included in the elimination drive. For IRS and other intervention measures. So what we need is a microstratification of areas targeting this risk population. That is something which is important based on the available data. So that data has to be foolproof, and then we need to get data from the health facilities reported in the hospitals as well as in the private hospitals. So coming to the different vectors, as you say, there are 6 vectors which I have told you. SIF and PSI is they are reported as the three variants, ecological variants, type, intermediate, and variety mysorensis. So, and then you have crucifixes. Basically, now it is 5 sibling species. The 5th sibling species E was was first described from Rameshwaram in Tamil Nadu. And then you have also Fivatils, STU, and V, which mostly was reported in Odisha. Minimus and Minimus sensostricto, it is basically in northeast areas. And then you have Dirus, Baima, basically the Dirus sexulato is Baima in mostly in northeast area. Elegans are also found in some areas in Kerala. And Sundaycus is restricted to Andaman and Nicobar Islands. So you also have, get to know, entomological inoculation rate. I would be talking regarding this much in the later stage, but still I thought of mentioning to find out the transmission load in the community. This entomological inoculation rate is and it's a product of sporozoite rate, human landing rate. So that is something which is taken into consideration for considering the vectorial, the potential transmission potential in a particular area. Malaria parasites, as I said, more are there. There are diverse coming to the topography, there are 4 major climate sea zones and mountain climate, tropical wet, tropical dry, subtropical humid climate. So depending on climatic zones, the vectors and parasites also are different in different parts of the country. So, and parasite species, there are 4 parasite species, but then Malasmodium knowles, the simian parasite, has been recently reported in Odisha and Kerala. And most malarious areas are central and eastern regions, Odisha, West Bengal, central states of Chhattisgarh, Madhya Pradesh. So, as such, in 16 morphology distinct species are there. 6 primary vectors that are reported, 4 secondary vectors, but then the number is dwindling because some other vectors are also picking up the parasite. And it is interesting whether, if they have infective stage, that is sporozoite stage detected, then it could be considered as a vector. But if they don't become sporozoite or it's just a oosus, it is just an infective state. It will not be infected. It's just an infected. It's not an infective stage, so that transmission can happen. This was the estimation, the basic, can work out, find out the breeding index and all different indices can be worked out as far as the larval immature control methods are concerned. So there are different breeding indexes. So it is could be mosquito breeding index to find out the immature symbol index for the immature density. It is pulling up the number of larvae and pupa, dividing by the total number of dips into breeding time. That will give the mosquito breeding. But then if you want to see the proportion of sites with mosquito breeding, then you can have going for general breeding index. So, or then proportional site with a given vector species, absolute breeding index. So there again, it's number of breeding sites positive for a particular number of breeding sites surveyed. But then if you see that to a given vector species in relation to the number of water bodies, so many water bodies are there, you would like to give a proportion of sites with given vector species, then you take the relative breeding index into consideration, number of breeding sites for positive for a vector for a particular species divided by total number of breeding sites, positive for mosquitoes. So there it gives, for example, in a pool of vector mosquitoes, how many are positive for a particular vector species. That gives the relative breeding index. Okay, so there are several steps involved in entomological investigations. I know that you are also involved in entomological investigation. So therefore, I thought I'll just list a few because this will help you to identify how you should be doing it. So first of all, you need to get, if you are been told to do an entomological investigation, you should find out the demographic particulars, map the area. You should also get the meteorological parameters, precipitation or rainfall, relative humidity, temperature, all these things, whether it's from weather station or not, you should get the information. Most important, you should get the detailed epidemiological data. And any environmental manipulation has happened or not, or is it due to some major changes like landscape changes or construction of a dam or construction of a canal, which changed the epidemiological scenario, that has to be taken into consideration. That is very important because earlier data, a few years data, it's better to get 5 years data, month-wise data, to get an understanding of how things have happened over a period of time. And enumerated data of the period of significance. This has to be done on a regular basis. This enumeration will only help us the percentage proportion of the vector breeding area. So that is needed. And also the larval source detection methods. There are different methods. I will be explaining you each method: sampling method, dipping, netting, bucket well sampling, well-net sampling, or pipetting methods, and different collection methods, whether it's indoor resting collection, whether it's indoor, outdoor, human landing collections, pyrethrum spray sheet collections, exit trap collections, and outdoor collections, and even you have CDC light trap collections also can be included. So, and the idea is to find out the vectors, to collect the vectors and then detect the parasite in the vectors. Once you get that, you can correlate with the epidemiological data and submit a report, so that would become complete data. And there are different types of mosquito surveys, whether it's preliminary, a short-term survey to gather baseline information. The outcome would be to find out the vector species identification, density, rusting and feeding behavior. So larval habitats, longevity, infection rates. So all these things will come out from the short-term, basic or short-term surveys or the preliminary surveys. But then you can have trend observation that is longitudinal. It could be for monthly, or it could be for seasonal, or it could go on for a year-long survey. So the outcome will be to check the impact of vector control measures. So you have vector control measures, whether it's larval source management or adult control measure, how it is going to impact a particular area, that you can do only by a regular or trend observations. You can also do a spot checks, randomly chosen areas, to find out any vectors breeding, or if there is any change, or if there is breeding or something. This will act to the long-term or trend observation. So spot checks can be done. So this also will help you to do a monitoring of how intervention is going on, whether the vector team are doing a proper surveillance or not. So you can do spot checks. You can also have foci investigation depending on the new or persistent disease transmission. Suddenly some specific areas you have some issues. So the outcome is to find out the reason behind why cases are coming up in a particular area. So larval sampling, as I said, no, there are different things. You can, normal thing is the dipping on the larval sampling using using a larval sampling method. So it's a dipper, or you can use a dipper to do sampling in, whether it's in the margin of the river streams or swamps at an angle, so that you can, with less disturbance, collect the larvae. You need to have specific techniques, training needed for that. And you can do netting in small ponds or small lakes. You can drain those habitats in big and smaller habitats. In wells, it's better to do a bucket sampling, or earlier, you could do a well-net sampling, but then bucket sampling would give you, whatever is the technique, the bucket sampling would give you a maximum number of, that also needs specific techniques to, without less disturbance, you should collect the sampling. That needs a specific training for you to do a bucket sampling. Pipetting is done normally in tree holes, leaf axils, hoof prints, small container. Hoof prints also will result in the breeding of Anopheles crucivaceus. Sometimes small containers also favor the breeding of some Anopheline mosquitoes along with Aedes and other species. So the sampling method has to be specific so that you can do it in a proper way. But not only that, after doing the survey, the collection of record is very important. The GPS coordinates, types of breeding habitats, sites has to be noted down. Origin of the water source, nature of water collection, whether it's puddle, rice field, or something like whether that habitat is exposed to sunlight, presence of vegetation, whether it's emerged or submerged, water characteristics. These are all important aspect when you write when you do a survey, so that this can help in writing the report, like specific breeding habitats. These observations are very important as far as entomologist is concerned. And for adult collections, again, you have to have the GPS coordinates, type of our construction materials, number of bedrooms and all, because you know that bedrooms are the place where bedrooms and living rooms are the place where you find a lot of mosquitoes, because of the the olfactory cues, and also the chemicals, the sweat and other things, also the carbon dioxide exhalation, which attracts vectors to come and bite you. And number of people sleeping in a particular room or not, whether they use LLIN or not, bed nets or not. So, and also these things also, you do outdoor collection sites or general characteristics. So these records, whenever you do adult collection, these things are very much important. So, and that can be also used for preservation, so that it could be training. You can train your juniors or students or somebody. So preservation has to be done, and also you need to whether to find out whether it's a new species or not. There are some techniques involved in detection. So the ELISA method, CS-ELISA method, so which helps you to find out the parasite in a particular vector. You could do the conventional method of dissection, but still molecular methods are also there. Sometimes it's very cumbersome to do all dissection, so many vectors. So, but then you can depend on the ELISA or PCR methods are also there. And blood meal analysis, that is to find out the host preference, whether the vectors prefer human or animal blood. That is something which is important. So that can be done also with counter-current immunoelectrophoresis methods. Cytogenetic analysis will help you to find out the sibling species composition. But then again, PCR methods of detection is also there. So, and you find the molecular analysis now, more and more analytical methods are there, and basically in research labs and colleges, so which they depend on these molecular methods. These are all confirmatory methods, so that the basic conventional methods still need to be continued, but still you can depend on these methods also, which helps you to rule out the infections. So here again, this estimation of the transmission indices could be the resting density for as far as adult is concerned. This is called man-hour density. So how many mosquitoes collected during a specific time. Man biting rate. Nowadays, the man biting rate is not man landing. The mosquito landing rate is taken into consideration. So the endophagic or exophagic indices. So whether they take blood meal outside or inside a house, that indicates the phagic specific phagic, whether they would like to bite outside or inside, because most of the houses are with repellents, personal protection measures, so that drives the mosquitoes outside. So you find sometimes mosquitoes resting outdoors, so that helps you to find out the endophagic and exophagic nature of the mosquitoes. The sporozoid rate, as I told you, so it could help in collection. So it could be dissection, PCR, ELISA method. Human blood index, as I said, so you can find out the mosquitoes which shows a preference to human or cattle blood. Here, I told you that that is also important in estimating the transmission potential in a particular area. So on some of these slides, I'm showing about specific studies done by us. So this which has been published also, like related to the vectors here. So earlier studies indicates that overtank and wells were the predominant breeding habitats, but then last few years when we did the survey, we found that overtanks were showing preferred breeding habitats as Anopheles stephensii is concerned. So the question is now, overtanks showing a fairly iron consistent mature density. So that is the preferred or the potential breeding habitat on a Stephens in a particular urban area. So you can have different methods, this collection in different over tanks, so that in addition to the other habitats, you find here in our tanks it is 95% of Anopheles Stephens breeds in here. But then you find mixed breeding also, Anopheles culex and Aedes together or singly. You find breeding of these mosquitoes in wells and other habitats include cisterns. So this is something interesting. You can, if you concentrate on over tanks and tackling the vector, so you could probably bring down malaria in urban areas. Similarly, when you do the physicochemical, you all do this water temperature and pH, but then if you see a water quality, if you see the water quality parameters, interestingly, you find that fluoride has found a positive correlation with this Anopheles Stephens breeding. It's because of the chemical cues, which has, though it is under CDC permissible limit. So it shows a positive correlation between fluoride and immature density, which is shows that fluoride can be considered as a predictor for urban malaria breeding. So that is something which is interesting in urban areas. And then coming to find out the rusting, feeding, and rusting preferences, you find conditions taken at cattle sheds, urban dwellings. You find the different conditions and the vectors collected. And then when you with the incidence, man-hour density, and the and the meteorological conditions, you find that man-hour density also varies depending on the temperature, and also it has a correlation with relative humidity as well as temperature. So incidence also varies over a period of time. So the host-seeking preference also, if you see predominantly this line, or it takes animal in, and you could also see the proportional infectivity, though it is 772 has been analyzed, only a few positives as far as Vivax is concerned. So that shows that the infection rate in the community is very less. But interestingly, again, here, Subictus was also incriminated PFN. So that means that Subictus plays a minor role in some areas, in coastal areas where the water is saline in nature, brackish in nature, not very saline, but then it is slightly more than 0.7 parts per thousand, which helps the in coastal areas because of the seawater intrusion in these areas. You find this breeding of these vectors. And if you, normally we depend on the weather station data for this different temperature, but then you have inbuilt techniques, or you have mechanism, or you have loggers where you could record the temperature in a particular locality. Only thing you need to, connect it. You could. It's a methodology. You can the data can be downloaded also. So it can be set in such a way that temperature can be recorded in a day or at whatever time frame you want, whether it's minutes or half an hour or whatever it is. So you find the temperature and relative humidity variations in a day or across the months. You find that in a day that you find that the temperature is higher during the mid-noon temperature. But then across the months, you find the outdoor temperature is lower than the indoor temperature. So that is something which is interesting. And then, but then relative humidity means that outdoor is always, whether it's in a day or across the months. So this helps us to find out the different temperature variations in and relative humidity in different structure types, whether it's asbestos, concrete, thatched, and tile. And depending on these temperature structure types, the temperature variations, we could work out the extrinsic incubation period, which need not be something. Earlier we used to depend on some published papers, but then you could work out the temperature, extrinsic incubation period with the temperature in the particular ambient environmental conditions. So that shows a minor subtle changes also will play a major role in the transmission potential. So this also shows an interesting thing where we need to have a microclimatic conditions playing a major role in transmission. We wanted to know about this socio-demographic behavioral aspect as far as a slum area is concerned. So though we know that in that slum area, vector breeding was not there, but in adjacent area, we found breeding was there. That was a high income group people. So we took socio-demographic history, housing pattern, breeding sources, mosquito control measures. So what we have done is we have analyzed this information and we found, so the result shows that positive correlation with the malaria, that is the occupation, number of inhabitants, and the presence of separate kitchen. All these attributes play. But then there are some attributes which has not played a contribution. So doesn't mean that some of these socio-demographic attributes play a major role. It may not necessarily influence, because there are other confounding factors which can influence the malaria prevalence. So that shows that, though we know all these factors are all playing the importance, but then it is not properly. Some of these are correlating with that, some of them are not. That's because of this particular nature of the movement. So it could be attributed to some other confounding variables. We also did some collections. We initially did some dust collection during nighttime. So dust collections during nighttime. So that was the normal method of collection. But then we found that dust collection is the time when the mosquitoes are in active phase, feeding or foraging phase. You may not get the resting mosquito. So therefore, you don't get the actual estimates of resting vectors. But then you should do early morning collections to get the resting collections. After feeding, they would be resting either in the cattle shed or human dwellings, depending on the interventions, depending on the house structure. So we found mosquitoes resting in cattle sheds. So the collections were collected mainly in cattle sheds, because in human areas, so you don't find, because of the personal protection measures. So this shows that indicate that cattle sheds are still the preferred resting place of Anopheles stevensii. And then dawn is the absolute perfect time to collect and estimate the vector densities. It is not that dust time you should do and then collect it, but dawn time will give you the actual resting collection. So this clearly shows that collections early morning. So for example, you can start 4 o'clock or 5 o'clock. In rural areas, you could start even earlier and get mosquitoes resting after taking a blood meal. And it also depends on, sometimes it's a publication which has been published recently in this month. So the roof type of a particular house also plays a major role in the resting of mosquitoes. It could be thatched or asbestos, and our collections, our studies have and indicates that. So, the thatched and the asbestos are the preferred roof types as far as the density is concerned. And we also have the temperature conditions of these structures in all the different structures, concrete, tile structures, and then the other structures which are there in the asbestos and thatched structures. But then you find most of these vectors are found in the asbestos, and this is based on the light trap collections which we made. So we could make the indoor and outdoor estimates. By and large, you find most of them are Culex fasciatus, but the proportion of Anopheles stevensii is comparatively less, but still you find more of Culecine mosquitoes were playing. And the density also differs from the indoor to outdoor, though there is not much striking difference, but then, it all, other factors also play in the, the density of the mosquitoes. But then we could collect Anopheles stevensii both indoors and outdoors. And then the interesting thing is that asbestos and the thatched were the preferred roof types. So that indicates that if you have a better roof type, like if you switch over to concrete structure type, you may not get vectors resting inside a house. So that is something which shows that, you should have the socio-economic status as and when it grows, you find less number of vectors resting inside, and therefore the malaria prevalence in a particular area. So one has to have a proper adult vector control measures in addition to the socioeconomic status, improvement of socioeconomic status. So we all know that in urban areas, it's the larval source management. But then at the same time, you should have adult control measures also, so that, the vectors can be tackled in those urban areas. This is an article which has come as Lancet Commission on Malaria Eradication. So what I want to highlight here is the new tools which are coming up. So envisaging from 2020 to 2025. So the vaccine was mentioned two years ahead. I think in 2019 this was published, and then we mentioned about the vaccine slowly being rolling out, and this has acted up, and then vaccine has come now in the picture now in some area. I mean, this has been announced recently, but then there you need to have better tools to tackle if you're interested. I mean, if you're point if your vision is to eliminate malaria from the country, so and that for that you need ultra sensitive point of care techniques, better vector control tubes. Some of these still in the phased manner, like new insecticides are coming, triple ACTs are going to come, better rapid diagnostic kits, ATs, attractive toxic sugar beets trials are being tested in some places. Then the new intervention strategy post 2025 will have better ultra sensitive rapid diagnostics. Like so many kits are being there. So this has been envisaged, and then slowly we may find that the elimination drive will be thrusted more, and then over a period of time, this eradication is expected by 2050. It's a long period right from now, but still elimination is going on in many countries, which we introduce, and this is something on the eradication of malaria. Okay, coming to the few definitions, I know that you all know about active case detection. So nowadays, active case detection is not there. It's in general terms, it is visiting to a house to find out the cases. So that is active case detection. But these definitions are important as far as as entomologist or a public health expert is concerned working on malaria. So you need to have know about this active case detection, whether it's going on in a place in an urban area, it's not, but then in rural areas, active case detection is there, and to find out, going to each house to find out fever cases are there, and then treating, testing them. And this is nowadays rapid diagnostic kits and bivalent kits in many areas, and then treatment is based on the results. And you also have definitions on endemic and epidemic, depending on the area over a section of years. If it is over a succession of years, it is not endemic. If it's at a given place at a given time, it is known as epidemic. So these definitions will help you out to understand the different terminologies. And you all know about focus or foci. This is relevant as far as the transmission potential is concerned. These terms are important. We know about the foci, or where the infection has happened. So where it is there, and it is based on the epidemiological factors and a lot of other factors involved. It could be the rare classified, it is classified in different residual active or non-active or something like that. But then this focus is a place, foci is a place where we need to. And we also say nowadays hotspot areas, so which helps us to find out that area where the cluster of cases are there. Incubation interval, so that is something as far as the period time when the occurrence of infective gametocytes in the primary case and the reappearance in the secondary case. So that is the time frame for incubation period, interval. And then you also know the incubation period of the clinical signs, and varies from the species, parasite species. So that is something. And you also know about, you also come across about the intensity of transmission, about based on the inoculation, particular area inoculation by the malaria parasites, inoculation by the mosquitoes by the with malaria parasites, and it is normally known as entomological inoculation rate, which I have already told you. So, and local mosquito-borne transmission. These are some terminologies which you need to find out. So we all know about the local mosquito-borne transmission occur in a particular area, because and that local mosquito-borne transmission is in a particular area. It has been bitten by a vector, a bite of a vector, and then cases are reported. That is not a local mosquito-borne malaria transmission, and transmission happens in a particular area. So that is something which is interesting as far as malaria is concerned. And elimination as such is something which the country is also envisaging, and then 2030 has been, that means thorough elimination has to be maintained for by 2027, and then we need to maintain that status quo for another 3 years, so that certification will be done by the by WHO. So and there, so we need to see that the re-establishment of transmission is not there. So, for example, we all know that many of the countries recently, also some of these countries, China has been certified elimination. So, like that, many countries has been eliminated, but then that scenario has to be maintained in such a way that there is sort of incidents and also to prevent re-establishment of transmission in that particular area. So that has to be taken care of. Then only we can the certification has been. So there are also some places where it is known as malaria free, that there is no continuing local mosquito malaria transmission, and it just only cases which comes are introduced cases from some other areas. So that is known as that area is free from parasite or the vector. The transmission parasite load is not there in the community, so the transmission doesn't happen. So you all know about incidence and prevalence, but still these are terms which are needed for as far as malariologist is concerned. So that therefore I'm including the cases. That newly diagnosed cases are known as in a particular area. So specific time is known as incidence, and then number of cases at any given period measured by the positive result based on by the diagnostic results, and over a period of time is known as at any given time is known as malaria prevalence. The strain also will different. We all know there are different strains. For example, in Vivax, there are different strains, Chesson and Bellum strains. So there are other strains also. So like that, there are strains which can be detected by the molecular methods, and the infection or the nature of infection also varies from strain to strain. For example, we all find that Vivax is there, but in some places Vivax is malignant. It leads to death. So there are strains which plays a role in the transmission, and it all depends on the strains and the susceptible population, the immunity. So many things are there. So the strains, parasite strain detection is basically with the help of molecular detection tools, and massive case detection is the symptomatic case detection at a particular health facility, that is massive case detection, and population at risk. Population living in a geographical area where locally acquired malaria occurs in a current or a previous year. So that particular area where the malaria cases occurred in a current year or population year, so it is known as population. It could be at a regional or a small area in a big city, so that we can consider that it's a hotspot area for and that particular area, that risk population, the risk groups would be there. So they are at risk of getting infection in that particular area. And also, as far as receptivity is concerned, so again, these are few terminologies which you should be knowing it, depending on the presence of anopheline vectors. All anopheline species are not vectors, but only some of them will have the potential to transmit to become up to infective stage, that is sporocyte stage. Some will pick up the parasite depending on the parasite load, but then it will not become infective stage known as sporocyte. So therefore, the receptivity depends on the vectors in the existence, and it also has a lot of factors, ecological climate factors, which favors the transmission and in a particular area as far as vector is concerned. Re-establishment of transmission. It is in an area when it has been cleared of malaria cases or something like that. So it's the renewed presence of constant measure. I mean, incidents, a few cases are depending on because of a particular disease in an area, and over a succession of years. So that is called re-establishment of transmission. So it gets again re-established with the renewed presence of the parasites or the number of cases reported in a particular. It could be probably silent, or but then it all depends on the detection methods by the diagnostic methods, and then you could mention whether this has been re-established or not. Surveillance is the unique system, and we all know. I mean, we have just which surveillance method is going to a particular area, finding out the cases, and then treating them. So all these things involve surveillance. If you go to the community, it is known as active surveillance. But if the community comes to a clinic, healthcare facility, it's called passive surveillance. There is another type of surveillance called reactive case detection methods, which bridges active and passive surveillance. So that is nowadays it's not there in the program, but then research organizations used to take it up so that to find out the extent of transmission from one particular case to in an area. So reactive phase detection is also there. If you are interested, so you can search the literature, you may get some information. Transmission season, so it, at a particular area. So it can happen, it could be for a short period, or it could be throughout the year. So this also varies and depends on the various factors associated with the transmission of the vector and the parasite and the area environment. And vector efficiency, as I said, we all know the anthropophilic behavior. For example, Fluviatellus has shown positive, very highly anthropophilic. But then other vectors like calciphases and all, they are basically zoophagic in nature, except for a few sibling species like A, D, and E. And in the case of Dirus group, AMA is highly, anthropophilic. And then there are other species which prefers cattle blood or animal blood, unlike human infections. And coming to the vectorial capacity, as I said, this has got a lot of factors involved in it. So it generally, if you say as such, the factors involved in vector include density. It is all dynamics of the vectors. It is whether the density, it's the relative humidity, the environmental factors, the longevity, frequency, feeding preference, so many factors, the length of extrinsic incubation. So all the bionomics of a vector is involved as far as the vectorial capacity is concerned. And it also plays from one place to another, and also in terms of the vectors. For example, Anopheles campi has got high vectorial capacity, unlike the vectors found in India, whether it's calciphases or and then compared to other vectors, we have better vectorial capacity in some places. Vectorial capacity also varies from one place to another. So this is something which is interesting, or it is relatively linked to the epidemiological scenario of a particular area. Epidemiology of malaria is concerned, so vectorial capacity is plays a major role because it brings into so many factors related to the vector. Vulnerability is in a particular area, whether it's vulnerable because of movement, whether it could be movement of people, or whether the vectors are many, and whether there are the vectors which picks up the parasite, whether primary and secondary vectors are also playing a role, and parasite load is there because of the movement, frequent movement, and then therefore that particular area become vulnerable to malaria infection. So these are some of these terms which I thought I could share with you.